Hello, my name is Jordan Bukla. I'm a doctor of nursing practice that specializes in hormone optimization. I'm also an elite level athlete, and I'm here today to discuss the differences between the estrogens in our body, as well as talk about the benefits and the possible side effects for AIs, which are called aromatase inhibitors. These are usually called estrogen blockers. A lot of people tend to use them when they're on testosterone, and I would like to discuss the pros and cons to it. There's three different types of estrogen. There's E1, E2, and E3. We're only going to be hyper-focusing on E2, which is estradiol. It's the most dominant in men and the one that I'll be referring to the most today. In fact, 80% of men's circulating estradiol comes from aromatization from testosterone into estrogen. However, just like everything, there's pros and cons to having too much of something and too little of something, particularly estrogen. Now, men, when they hear the word estrogen, they run. Don't hold on now. Estrogen is still very important for your joint health, for your bone density health, cardiovascular health, your erectile function, your libido, your mood, your energy. Now, some men, when they come and they have too little of estrogen, a lot of those symptoms would come as dry joints. They'll come as low libido, erectile issues, particularly flat moods. When men have too much of estrogen, they can get gynecomastia, which is breast tissue development around the nipple area, tender nipples. They start crying at commercials all of a sudden. They can also paradoxically have ED, erectile dysfunction, as well as low libido too. Now, the range that is most optimal for men is about 15 to 45 of E2, estradiol. Most optimally seen in the 20s and the 30s. Now, these pros and cons of having high estrogen or too low of an estrogen is why it's so important to keep up with your lab work during your TRT usage to really ensure that your lab values are within safe range that will prevent you from getting issues like gynecomastia, which is really hard to fix once it becomes present. And now let's discuss that a little bit. If you have gyno, especially in the first couple of weeks, it can be reversible. But once it starts going into a couple months, a couple of years, it now becomes a very difficult thing to get rid of, most likely requiring surgical intervention. Now, who is at risk for high estrogen? Particularly men who are overweight, as well as on high doses of testosterone. What makes it an even more of a risk is if you're on that high dose of testosterone and you're only injecting once a week. Now, I mentioned overweight. That's because adipose tissue or fat tissue contains aromatase. That's that enzyme that converts testosterone into estrogen. So the more you have of it, the more likely it's going to be used for conversion, particularly in visceral fat. A lot of times when you see the men with the big bellies, but when you touch them, they're hard. That's because the adipose tissue is inside of their abdominal cavity, surrounding their organs, which is at a higher risk for diseases, but also at a higher risk for high estrogen, as opposed to subcutaneous fat, is that more pinchable fat, that soft adipose tissue that's outside of the abdominal cavity. In fact, weight loss can help lower your estrogen without any medications. Now, I also mentioned the fact that people who are at high risk would be high doses of testosterone once a week. It has been shown that if you decrease that dosage and you split it up into numerous of doses throughout the week, you're at a lower risk for that high estrogen production. I want you to keep in mind how important it is to understand the range that you are in for your estradiol in order to make sure what you are at risk for. This would require blood work and some possible intervention. Here at BioRestore, when we start you on a regimen, we complete blood work every 10 weeks to ensure the regimen that you are on is safe, reliable, and giving you the results that you need. Feel free to call us at 203-491-2999 and book a consultation with us so we can take a look at your blood work together.